During the first 6 months since Manchester University NHS Foundation Trust was created, so much was achieved. We wanted to keep you informed about how teams have been sharing their strengths to provide better, safer, more consistent care.
Since the Trust merged on the 1st of October 2017, there's been a massive amount of progress across all of our sites, and I just really want to thank everybody who's been involved, because we couldn't have done it without all the staff working as hard as they have. The next most important piece of work that we're about to embark upon is developing the clinical strategy, which will really target the benefits for patients, which was the whole purpose of the merger. And that will involve all of our staff redesigning and improving our services to deliver care to the highest standard possible as locally as possible.
Since the merger, we're already seeing many benefits for patients and staff emerging.
What has impressed me the most is how people have risen to the challenge and how they've worked together. We've carried out a number of clinical workshops and we've had excellent engagement. It's not all been easy, but there's a real willingness for people to transform services for our patients. There's been a number of positive improvements, and one of those is within our shoulder and elbow orthopaedic service. The team have come together to develop a vision and a plan for a one-stop service, and also to introduce innovative virtual clinics.
The patient can, having been referred by their GP, can come and see us. They'll be assessed in the clinic and have investigations carried out, and either treatment provided on the day, for example, if they need an injection, or if they need to see a physiotherapist, or their treatment in terms of an operation planned.
The patients benefit because they come, they have the answer, and in some specific cases, even treatment can be offered on that day. That's huge.
Because of the merger, we've been able to pool our resources to improve the quality of healthcare for our patients.
What it has really allowed us to create this critical mass of clinicians, so that logistically it is possible for us to offer these services that we haven't been able to.
Teams could also work together more closely during the flu outbreak over the winter. By learning from previous experience and best practice, the infection control, microbiology and employee health and wellbeing teams worked hard to make some significant improvements to delivery of the vaccination programme across all sites.
One of the big advantages of us being one organisation now is that we've always had flu vaccination campaigns. And we did really well on the Oxford Road campus this year. We've vaccinated twice as many staff as we did last year. But Wythenshawe site managed to achieve over 82% of their staff being vaccinated, and we've learnt some really valuable lessons.
It helped that we had merged, because we were dealing with effectively one infection control team rather than two. Beforehand there would have been one team at one site and a different team at the other, but the fact that they were working together made it easier for us to interact with them.
Some of the other benefits we're already seeing are doctors being able to attend education and training sessions across sites, making it easier to work around their patient care schedules. Reducing overcrowding in urgent care waiting areas by working together to identify patients who can have same-day treatment and return home. Staff being able to request books and research from across sites, improving their learning and development opportunities. And an e-rostering phone app being rolled out across the hospitals, helping doctors to manage their rotas more easily, meaning better shift coverage throughout the week. Staff are also benefiting from the rollout of a 24/7 assistance programme, which serves all 20,000 staff at MFT's 9 hospitals.
Following the merger, what we've been able to do is roll out what we call as an Employee Assistance Programme, EAP, which is providing our staff with access to 24/7 advice and support on a whole range of issues that impact on either their physical or mental well-being.
The next step is for North Manchester General Hospital to join MFT. We have already successfully worked together to support recruitment at North Manchester. 11 consultants were jointly recruited in obstetrics and gynecology, based across St Mary's Hospital, Wythenshawe Hospital and North Manchester General Hospital.
The main reasons that people wanted to come were that they recognised that across such a large organisation there would be lots of professional development opportunities, that if they had a special interest that they'd be able to develop that area of expertise. One of the other things that people have found really attractive is the new consultant development programme, which has been really popular with previous applicants.
We will now look at how we can use this approach across other specialities to improve services for patients. Work is now moving forward for North Manchester General Hospital to join MFT during the second half of 2019 to early 2020. To get regular updates about MFT, visit www.mft.nhs.uk.